All right. We are Team 3B. My name is Mark, and this is our team. We're going to start our presentation on radical belonging in healthcare and our proposal to uh, uh, make changes that promote the culture of radical belonging and modeling methods of inclusion at the healthcare fair that we were tasked with doing. So I guess we'll jump right in. Next slide. Um, so First we're starting with our definition of like what is radical belonging, in order to like capture the spirit of what it is. And so we defined it as a collection of interactions and relationships that offer mutual respect, love, understanding, and care. The goal of which is to encourage an environment of inclusion for all races and backgrounds. So we have three overarching goals underneath that: to boost unheard voices, promote openness towards new perspectives, and to foster team environments. And so, furthermore, according to literature, such as Louis et al., radical belonging was conceptualized as a changing of the root, quote unquote, in order to foster a sense of belonging for those voices who felt like they weren't being heard, especially in for people of color who did not feel like they were being heard or seen as equals. Um, and so while literature sources define radical belonging within the context of the school environment, which they saw as the fundamental communal experience, uh, we are not limiting our definition to just the school environment. We're also applying it to the healthcare interdisciplinary environment. An example of how this concept can be applied to other areas can be seen in even SSM's health policies. For example, SSM Health discusses the importance of diversity in all areas of healthcare, not just the workforce. They explain how they are dedicated to promoting diversity in their patients' workforce, suppliers, and so on. When interviewing our peers, we found that they define radical belonging in any ways, but the common uh, purpose of which they said was to root out racism from common spaces. And so when implementing our definition, we promote the boosting of unheard voices, openness towards new perspectives, especially towards those of underrepresented communities and races, in order to foster a collective team environment to improve healthcare for patients. Next slide.
So I'm not actually able to see the text there on the top there, but I will go ahead and be reading that in some of my definition here. Now that we've defined radical belonging, we can talk a little bit about why we believe it's important. And so what that first bullet point there is supposed to say is that belonging fosters effective communication amongst team members, and this allows for increased understanding of others' roles in the context of the team. Belonging also encourages mutual respect and support for others. It allows for more comfortable and efficient conflict resolution. It also allows for inclusion of voices that may offer additional previously unconsidered perspectives. Belonging ultimately leads to increased feelings of job satisfaction, as well as increased confidence in delivering care. Belonging is important to patients as well, so it can lead to improved patient outcomes due to improved team efficacy, as well as increased understanding of the diversity of the patient experience. It can also lead to increased confidence and patience from patients and their families. And it also empowers employees to be more willing to speak up about issues they see and propose their own solutions, because overall people can have the confidence to know that their voice matters. Next slide. Okay, so we actually propose a variety of ideas in various areas that aim to create change from the top down as well as from the bottom up. And so starting from the top down, we have various aims at the organizational level, including the formation of an interdisciplinary team. And so the creation of an interdisciplinary team, such as the team huddle, with leadership that meets with individual team members to communicate specific needs, successes, and problems that arise in the process of addressing inequalities in healthcare. We also propose the creation of a feedback system that allows for anonymous feedback about another team or its members, in order to ensure that employees know, and also to ensure that employees know how to submit feedback. Um, a separate feedback system could be created for patients as well as outside entities that work with the hospital to voice their concerns about perceived shortcomings and inequalities that are created by the hospital's business. At the team level, we propose an accolade system, and this would involve staff encouragement and acknowledging successes and efforts of others, so people on the same team as well as other teams, and also quarterly and daily meetings that can encourage follow-up on Equitas goals, as well as the ensuring that team members are on the same page and that they are sharing common goals and ideas. And then in discussing how we can implement different mechanisms to improve belonging from a bottom-up perspective, we propose that mHealth Fairview offer talk therapy, as in psychotherapy, essentially to all the individual employees, so that you can actually help individuals identify and change emotions, thoughts, and behaviors so that they are themselves better members of the team. And next slide.
Okay, so now we're gonna kind of discuss how our intervention will actually consider the inequitable impact of COVID-19 on marginalized communities. So just kind of a quote to start us off here, but the pandemic amplified historically rooted structural inequities and social factors that shape health disparities among marginalized communities of color. So we do need to ensure that the data that we do have is not biased, and that it is also essential in describing the health disparities and how to approach them as well. With this, we also need to have social services and interactions for the older population to ensure proper care, and that we also have improved human interaction, even times of COVID-19 or other severe illnesses where they may not be able to see other people. Next slide, please. Okay, so our next slide discusses how we will actually address these COVID-19 stressors for the healthcare team members as well. So we first do need to confirm that the health data that we have collected is correct in all the entities. And then we must review the statistics to create an approach to the problem with justified solutions from the given data. And then we will next address feelings of isolation with the daily team within our individual gatherings and one-on-one meetings with team leaders and their staff as well. And then also we just want to remember to continue to encourage staff, reiterate words of support, and then also kind of discussing before, just offering several free psychotherapy sessions to familiarize employees with the potential benefits of therapy, and also just allow a potential barrier to seek out care if it is needed. Next slide, please.
Grant had already kind of mentioned some of our actions to create the culture of radical belonging, but some ways that we plan to implement those actions are to create a diversity and inclusion committee, and hire a professional to actually lead the committee. And then the rest of the committee would be volunteer based to ensure that participants are motivated and they don't feel as if we're adding more unwanted work, especially amongst the COVID burnout and staff shortages across healthcare. And then we would also have leadership guide certain sections of the committee to encourage a top-down reform and demonstrate support from leadership to foster an inclusive environment and culture of radical belonging through the organization. This committee would work with team leaders to organize the formal huddles with their team. So they would designate a team, a department leader that employees could go to with concerns and feedback. And then that leader would then meet with committee members and leadership to relay that information. So this just ensures that there's always an open avenue for ongoing discussion. And during these team huddles, we would also be discussing accolades and successes of the team for continued encouragement and building team morale. The committee would also conduct structured interviews with those leaders from the healthcare team to discuss the degree of inclusion, excitement, challenges their teams are facing, and to identify perceived needs from the organization and how they could better help the teams and kind of in an individual level. We would also suggest cultural competency training modules for employees that would be added to the normal compliance training modules that are already commonly required by hospitals on a yearly basis. And then set up employee resource groups or group therapy, which would be led by professional psychotherapists within the organization. This would offer a network for like-minded individuals or for those who might be sharing similar struggles to kind of help find support and learn new strategies to effectively manage their stress and facilitate open communication. And then could also offer private therapy sessions for those that feel that they need it to kind of remove that barrier to therapy and counseling that is currently being experienced kind of across healthcare right now, and reduce those wait times to see a therapist if somebody really needed extra help. Next slide. And for our metrics of success, we would send out feedback or satisfaction surveys given to both patients and providers. This would help us reevaluate feelings of inclusion, belonging, job satisfaction, and then also how patients perceive their providers and their healthcare team, how they feel like they're doing in managing their care, which could be a direct reflection of how the teams are communicating and working together. And then also offer anonymous screening forms inquiring about compliance and the perceived effectiveness of the team huddles and the actions taken to promote this culture of radical belonging. Basically, just to make sure that employees feel that these actions are actually helpful, and then they could also offer new ideas to be brought forward for ongoing actions to implement an inclusive environment. Next slide.
So for this idea to be successful, we kind of talked about how it needs to be both sustainable and scalable for our organization and our setting, as well as other healthcare settings and organizations. So we could consider this idea scalable as we are able to use it to kind of grow and meet increased demand and change within our actual healthcare setting and the society in which we are in. For example, we took an idea of how to make it scalable from the Checklist Manifesto. So this is a book that kind of details how, despite providing written instructions for a checklist, the checklist was not successful. It was considered unsuccessful until the teams were observed and kind of corrected to ensure the proper use of it. So this was a similar idea as to what we were thinking in providing shadowing and observation opportunities throughout both in-network, out-of-network hospitals, as well as other businesses and organizations. So we are ensuring that the ideas of the team huddles and the interdisciplinary meetings have proper implementation and compliance within our actual setting. We are also ensuring that with increased demand or change, we can kind of adapt our implementation and compliance of this program pretty easily. We also discussed how surveys can continue to keep this program scalable. So this can also be applied to other systems and organizations in understanding how this program is kind of working and how they can best improve it if it's not working to the part which they would like it to. So these surveys can also determine impact and then can be extrapolated to other organizations to see if similar interventions have similar improvements within that setting. So the other idea that we talked about is how this is sustainable to other healthcare settings. So For this idea to be sustainable, we kind of considered the financial and resource burden that would exist on healthcare providers. For example, the overall cost of implementing, including a potential hire of one individual or one new worker, for example, can ease stress, can promote more diversity in the workplace, also then providing improved satisfaction of workers, better work habits. So including one team meeting per day or one interprofessional team meeting per month is not a difficult time commitment for the healthcare professionals to be making, especially with all of the known benefits that can arise from them. Also, when productivity rates might remain unaffected with these meetings, then their time is still under consideration. Finally, kind of utilizing psychotherapy sessions for the healthcare professionals for just the overall improvement of individual mental health, especially with the psychological strain that kind of resulted from COVID-19. These can be beneficial, which we can kind of talk about on the next slide.
So the expected impact of our proposal will be both immediate and ongoing. If employees buy into a system where they feel that their concerns are being heard and acted upon, they'll be more likely to become active participants in that system, which will perpetuate its success. Employees who feel that their opinions are valued are more likely to share that input without fear of reprisal from their colleagues and superiors. This will lead to an increase in communication between all members of the healthcare team, which will ultimately improve patient care. Fostering a work environment centered on communication and patient-centered care will also help to improve overall job satisfaction across all specialties, which will result in less turnover and improved retention rates. The staff shortages continue to have a significant impact on job satisfaction in the medical community. As medical professionals leave the bedside, those who remain are burdened with an increased workload, longer hours, and fewer resources to provide the care. So making measurable, lasting improvements requires that we address the root causes of burnout, job dissatisfaction, and high turnover rates. The concept of radical belonging ensures that early interventions can be implemented to address the concerns of employees across all of the specialties as they occur, rather than allowing them to become unmanageable. Providing psychotherapy services will benefit the organization as a whole, as research has linked it to improved emotions and behaviors, as well as positive changes in the brain and body. Participants in psychotherapy report many significant benefits, including fewer medical problems and increased work satisfaction. Employees who report a higher level of job satisfaction experience less burnout, contribute to improved retention rates, and provide better patient care. As retention improves, so too will communication between team members who remain engaged with colleagues across specialties. This type of open communication and the idea of radical belonging will become the norm for new employees rather than the exception, which will further compound its success. Higher retention rates will also have a positive financial impact on the organization. Research suggests that nurse staff levels have a positive association with financial performance in competitive hospital markets. Aside from the obvious costs associated with recruiting and training new employees, lowering workloads has also been linked to decreased mortality rates and overall cost savings for hospital systems in competitive markets. The impact of implementing radical belonging into our organization is overwhelmingly positive. Open avenues of communication foster a sense of trust and mutual respect across specialties. It offers a platform for effective conflict resolution and contributes to increased job satisfaction and retention rates. All these benefits culminate in our ultimate goal of providing exceptional patient-centered medical care across all specialties. As far as for the team project, this project allowed us all the opportunity to work within or with multiple disciplines within St. Louis University. We worked together to reach a consensus on how to best implement radical belonging into our organization. Each team member contributed valuable insight from their respective practice and provided a framework for establishing a sense of radical belonging for each of the other specialties within the group. Compiling input from each discipline allowed us to better understand how to effectively provide patient-centered care from a holistic perspective, ensuring that all disciplines are represented in the overall care of each patient.
And then I think we have one more slide on the resources, if you just go through that. And so those are our cited resources as well.